Fears of fleeting transmission now unfounded in 2 cases that were linked to Melbourne's current outbreak and have been deemed to be false positives.
The government just don't seem to be able to get this right, do they?
Victoria's Department of Health says an expert panel has declared a man and woman did not contract COVID from a stranger.
Basically what we've got, Peter, is a gross overreaction to 2 or 3 cases every day.
It's actually very hard to get clear estimates of both infectiousness, that degree of how many people in a household or a close vicinity are going to be infected, as well as the speed of that infection.
The primary close contacts of the cases will be released and exposure sites rescinded, including every current at-risk location in Anglesea. Both cases were supposedly examples of what Victorian authorities feared was fleeting transmission.
So I'm sure that's going to reassure the health department, and while it doesn't get rid of all of those more casual transmissions, it was certainly one of the more worrying examples that they presented.
Where strangers caught the Indian super strain of the virus from people they didn't know after brushing past an infectious Melburnian. The so-called fleeting transmission has been a major factor behind Victoria's extended lockdown, despite medical experts like Peter Collignon disputing the current outbreak's actual infectiousness.
To say this disease is a beast is a gross misrepresentation. I think this is just causing an enormous amount of alarm in the community.
Victoria's opposition leader has joined calls for an early exit from the current lockdown, tweeting, "If the basis for the lockdown extension turned out to be false, it should end." No sign yet from the government about whether it could mean an early exit from the extension. Anna Rawlings, Sky News.